Dr. Hajela, another question for you. You mentioned last episode that addiction has a survival value. What do you mean by that?
Well, what I mean by addiction having a survival value is that people with addiction, they achieve more and they propagate more. Because, in our society, survival, especially if we look at centuries past, where people didn't live as long, and also people had to really focus on just the basics of food and shelter for survival. So someone who is a high risk taker, who makes a mark in the world and receives a certain status, then not only will they be ensuring their survival, but they attract more women. They would be the ones who will have more children, perhaps, both legitimate ones, and perhaps if addiction takes them to engaging in sexual activities with multiple partners, then there will be more children born. And of course, as we are coming to understand that the genetics has such a large part to play in the disease of addiction, then all those children will be similar and they will propagate their genes. So if we look through history, because we know that there is no uncontaminated gene pool anywhere in the world, like all human populations around the world are vulnerable to addiction, and addiction is a fairly common disease, which is why I call it an endemic disease, meaning it's in the human genome and it's in every population, that people who have addiction have a high survival value, and the evidence for that is that it is so common. So it has existed in the human genome for thousands of years.
Yeah, I see. Thank you, Dr. Hajela, and I really appreciate your insight into this point. May I move to another point? Why do you think some people feel sick from certain drugs, others feel okay? Like some people drink alcohol, for example, and they get flushed, they get headache, severe insomnia. On the other side, others can drink alcohol and they feel okay, they feel calm, and they have a good sleep. Why is this happening?
Yeah, well, with alcohol, we know. So alcohol is a great example. And alcohol, because the research on alcohol has been done for such a long time, and we understand the mechanism by which alcohol is broken down in the human physiology. So the first level enzyme to break down alcohol, which when we use the term alcohol, it's actually ethanol, so ethyl alcohol. And the first level breakdown with an enzyme called alcohol dehydrogenase is to convert alcohol into acetaldehyde. So chemically speaking, it's an aldehyde, and then from acetaldehyde, it requires another enzyme called aldehyde dehydrogenase that breaks it down into acetic acid, which people commonly understand as vinegar. So the acetaldehyde part, which people may recognize the aldehyde because the word formaldehyde is more familiar to people, and formaldehyde is something that's used to preserve tissue, and formaldehyde is the aldehyde produced from methanol, or what people commonly know of as wood alcohol. So it is the same enzyme degradation, and if you understand that formaldehyde basically pickles tissues, so you can perhaps understand more easily that acetaldehyde is a pretty noxious substance. So in populations of humans where there is a deficiency in aldehyde dehydrogenase, then the acetaldehyde accumulates, which produces that noxious response. And we know that in the East Asian gene pool that there is an inherent deficiency in the acetaldehyde dehydrogenase. So the Asians from that part of the world are more vulnerable to that, so their volume of drinking is decreased. Now this idea that chemicals that are taken in the body, they have a different effect depending on the genetic makeup, is a very robust idea. And that's where we have known for a long time, when we prescribe a certain medication, it works better for some people and it doesn't work as well for other people. And the research is ongoing, and I couldn't even begin to tell you, but if people are interested, they can do some research and exploration. And there are some genetic testing things that are available where people can have themselves tested, which gives people an idea of their enzymatic makeup, which then predicts as to which drugs will be more effective for them and which drugs may not be as effective. So we are moving towards, in our society, to a more targeted medication use as well, which is a very exciting thing for the future. Now, having said that, I must emphasize that even in people who have the aldehyde dehydrogenase deficiency and they're not able to tolerate alcohol, it doesn't mean that addiction problems are any less. Because in the East Asian gene pool, the problems related to gambling and opioids are pretty significant. So if you look in that part of the world, then you'll find addiction involving gambling and addiction involving opioids. And historically speaking, people may remember the opium wars. They didn't happen for any reason because that gene pool, those people were not interested in alcohol because of this genetic difference. But of course, they were very susceptible to taking up opium and taking up gambling. And actually in the Asian part of the world, even today, video gaming and addiction involving technology, specifically internet sex and internet gambling, are a huge problem, which people are starting to recognize and trying to find ways to address it.
Thank you, Dr. Hajela.